So today I'm going to talk to you about dog CPR. You would use this if if you came inside or outside and saw your dog just laying on the ground not breathing. First, you would want to check check their pulse by going up their hind leg up until you can't, then checking if you can feel the artery. If you're not, then you may want to press a little bit harder. Then, if there's no pulse, that means they're not breathing. Then you want to go straight to compressions. You want to do compressions to their ribs, and you can find that and where their heart is by using their front leg and pushing their elbow all the way back, and that should tell you where their heart is. Then for small dogs, you want to use the heel of one hand and give compressions. For larger dogs, you want to use two hands. Then after you give them compressions, you want to do a cycle of the compressions and giving breaths. You want to give breaths once you have your hand covering their mouth and their nose over and your finger over their nose, but not directly because it'll block the airway. Then you can start to give them air by breathing in through their nose. If it seems like the breath they're not being filled with air, then you can remove your hand and try and open their mouth and see if you can see anything that might be stuck there. If not, then you can go back to doing the cycle. So when you're giving them breath, before you do that, you want to cup their mouth. So you want to have your hand like this to make sure that their mouth is shut, and then your finger over the bridge of their nose, only not directly over top because that's their airway, so that's where they breathe. Then after that, if it doesn't seem like it's working, then you want to start to give compressions. For smaller dogs, you want to use only the heel of one hand, and for larger dogs, you want to use two. So you would find their rib cage by using their front leg and pushing it back, and that'll tell you where some of the ribs are and where their heart is. So then you want to start to give compressions, and you want to give them hard compressions so that it starts to get their blood and heart moving, so then they can start breathing again on their own. If that doesn't work, then you want to keep doing the cycle continuously until they start breathing again. Then once they do, you go to your nearest vet and then have them assess your dog. So I just wanted to show you what it would look like for giving CPR on a larger dog. So finding their heart, it's exactly the same. You would just pull their arm back, and that's generally where their heart should be, and that's where some of their ribs are. Then it's a lot harder on a larger dog to close their mouth, so you want to make sure that you close it as tight as possible. And you don't want to try and get anything out of their mouth if you can't see it at all. And with a larger dog, you want to use two hands and push right here where their ribs are. You want to use two hands instead of one, because obviously it's going to be more pressure to be able to bring the dog back. So a few reminders. One, you do not want to practice this on a healthy dog because it can be dangerous to their chest and their breathing. you're one way you're able to see if your dog is in distress is they would be laying out on the ground, not responding to anything, and um, so I think this is an important lesson to learn for if you're gonna have a dog because it can be life saving for them. So.